I never knew how widespread HIV/AIDS was in the Black community. It wasn't until I came to the Arizona Community Foundation that I understood its impact and how widespread it was. I thought we had conquered it. I did not know it was a huge epidemic in the Black community.
It's shocking to talk to physicians and nurses who think that we've winning the battle hands over foot and we just got it together and the incidence is going down and the numbers are going, when in fact the numbers of deaths in African American women are skyrocketing.
The Arizona Community Foundation is the state's largest grant maker, but it is also a foundation that connects the community. Our role is to lead, serve, and collaborate for a better Arizona.
This was given to me not due to my own choice. I was raped in 2003. I felt angry. And I knew exactly where it came from. That's the whole craziness of it. But it wasn't nothing I could do about it. All I had to do was I just need to focus on being healthy. I was scared, too, of the fact that I had this virus that could turn into AIDS and possibly kill me. So I just dedicated myself to being healthy and outliving it. I refused to give in to it.
So I convened many people who had already been working to solve this problem, but have been faced with many barriers. Ebony House, Aunt Rita's Foundation, Native Health, Taros Health, Vitalis Health Foundation, Black Chamber of Commerce, Mountain Park Health Services, the City of Phoenix, the Office of Congressman Ruben Gallego, all coming together to help solve this problem because they have seen it, but they have not seen a lot of results in helping to spread the word, and outreach has been very difficult.
It's really very personal for me. 9 years ago, my daughter, April Michelle, the light of my life, died of HIV. The one thing that I know for sure is silence and keeping quiet is not only not an answer, it's absolutely at this point a crime because people die unnecessarily. I would hope that no one else, no other parent has the burden that I had, and that is of burying a child. We all expect our kids to bury us. No one should ever have to bury their babies.
Because I see young people who they're young enough these days to be my kid, and they come into my services and they're newly diagnosed, they're scared, they have all of these fears about life in general, and it makes them believe that they can amount to nothing. And that's not the case. HIV is a disease. That's it. That is all it is. It is a medical condition that we can conquer and we can do something about.
I was diagnosed with AIDS in 2005. Getting tested, knowing your status, getting into care, staying in care. If we can accomplish these things, we can effectively end the epidemic. So it really is going to take, I think, the African American community, leaders within the community to stand up and solve the problem with as much help as we can give.
We said, well, let's start just by talking about it. And so this town hall with community leaders from all segments of our population aims to do that. Then they're going to know how widespread this disease is, that Black women are now 20 times more likely to be infected than white women, that Black men are now 6 times more likely to be infected than white men, and that our kids, 13 to 24, now represent 20 to 26% of the newly diagnosed cases. Once you know those numbers, you can't just sit back and shut your eyes and shut your mouth and be silent. Your population is sick and you've got to do something about it. So that's what we're going to be discussing in this town hall.
So when you think about African Americans versus whites and why the health disparities are the way that they are, I think that it begins and ends with the Affordable Care Act. That was one of the greatest things we could have done for the African American community because it allowed more Black people to get health insurance and therefore get routine health care.
What I hope comes out of today's gathering is simply people talking openly and fully about the facts of the disease and what we face. Where are we today? What can we do to help resolve it or make it better, or at least minimize its continuing impact?
Ain't nothing wrong with me. I got a virus. It's like a cold. That's how I put it in my mind. It's a cold. And how do we take care of colds? We take care of ourselves. We do what we need to do to keep it either away or under control.
HIV is so easily prevented with the use of condoms and now with PrEP, pre-exposure prophylaxis, which is about 94% effective. It's a pill a day, and if you're in a high-risk group, the chances are that you will not contract HIV.
Put that information out, educate those people that we're in close contact with, but most importantly, educate the young people, the young males, the young females, heterosexual, homosexual, how to prevent the transmission of this disease.
There's no judgment here. I don't care what happened before. Let's talk about what's happening right here, right now, today. I have hope and I have joy in my heart that this is happening. It's been such a long time coming. So I believe that this is a great first step. I believe that we can make this happen.
BlackHIVAZ.org will have numbers, it will have resources, it will have conversation, it will have all the information they need to continue the collaboration. So I advise people to go to BlackHIVAZ.org to get connected. We're here for you. We want to help solve this problem. We know we can do it. We can only do it together.